With funding from the National Science Foundation, the U.S. Department of Defense, and Synthase Corporation, the Institute for Biological Interfaces of Engineering is at the forefront of biomaterials technologies.
One of the major areas that we are basically involved in now with regards to orthopedics is the interface between biomaterials and the human body. And without investigating that interface, no matter which systems you're in, we are going to be in great troubles. So starting to look at interfaces is certainly going to be, I think, the way of the future.
The Institute is bringing together accomplished researchers and clinicians across disciplines to solve complex problems and to quickly move those solutions from the lab to the clinic.
It's not just one university or one scientist, but it's bringing together the specialties and the talents of many scientists to solve a single problem. A good example of this is what we're doing right now with the Medical University of South Carolina.
Dr. Betsy Davis, a prosthodontist at the Medical University of South Carolina, and Randy Emmert, a graphics and industrial engineer with Clemson University, are using their seemingly unrelated areas of expertise to benefit patients with head and neck cancer.
It's, I think, one of the most devastating forms of cancer because it affects your facial appearance. And when speaking, swallowing, and chewing, folks come to me because they are missing a part of their mouth or part of their face. And so my job is to make a prosthesis so that it will restore function for the patient.
Prior to this partnership, it took Dr. Davis and her staff up to a week to hand sculpt and paint a prosthetic nose, ear, or eye.
But with the new technology that we have available now, we have actually adapted and sculpted in one day as opposed to 3 to 4 days.
With the computer model, it's less time being here and gives you more time to be at work. You don't have to take vacation time or anything like that. And it seems to fit better than the hand sculpted one did.
People around the country and around the world are using the technology, and they do it on sporadic basis a lot of times where it may be done to show that it can be done. No one is really doing it on a routine basis in a regular application with the clinic where we have that direct contact with the doctor and with the patients and giving them the prosthesis or the product that they are looking for.
Through IBIOE, researchers and clinicians like these will be able to work together not only in the real world, but in the virtual world, utilizing a highly sophisticated cyber infrastructure.
Clinical research and surgical training is very regional. And so if you connect only with one particular academic medical center, then you're getting one perspective only. And so the beauty to IBIOE is that you can actually connect with a diversity of medical centers, not just in South Carolina, not just in the United States, but globally.
This direct communication between our group, which is here in Charlotte, and the group in Clemson, but also some clinician dispatch in multiple areas within the country or within the world for that matter. So that basically shorten the time between the information gathered in a research setting and as a clinician.
While the science of IBIOE is cutting edge and complex, and the future implications are mind-boggling, the underlying goal is fundamental.
This interaction and the networking and the creation of the Institute involves the surgeon with the scientist, and the surgeon's clinical problem drives the issues that the scientist is solving.
So this allows us to take these discoveries and not keep them in the research lab, but to move them out into the public and to use them to make a better life for people. That's what this is all about.